Welcome to Talk to 'em, a weekly show where we discuss self-help strategies, pop culture, music, education, fashion, relationship, and how it all links towards financial success. Make sure you follow us on Instagram, YouTube, Facebook, under Talk to 'em. And of course, I'm your host for the show. My name is James Levesque. Talk to 'em. Let's vibe with me. All right. Folks, we have an incredible show for you today. We have some amazing guests in the studio with us. Ladies, you guys want to introduce yourselves?
Me first? Okay. Hi, my name is Hadia Severin. I am a recent MPH grad. I got my bachelor's from Oakwood University in Alabama. Shout out to my HBCU.
Okay.
And I am an educator and I work in maternal health.
Okay. What about you?
Hi everyone, I'm Anissa Dahir. I am currently doing my master's at Tufts where I met these lovely ladies. And I am doing my master's in public health as well as physician assistant. And I got my bachelor's in public health also from Westminster College in Utah.
Oh, wow. That's what's up. And you are?
Well, everybody, I'm back.
Back again.
It's been some time,
It's been a little while.
but we're back. And I had to bring my homegirls. These are my homegirls from Tufts. For those of you who don't remember, I go to Tufts as well. I'm doing my master's in public health.
So let me ask you guys this: like, why get a master's in public health? Now let me go back a little bit. Number one, what is public health? Because I heard you guys talking about there's different levels of public health, and you guys are just in different segments of public health. So what is public health? This goes to anybody. I don't have to,
It's a loaded question.
Yeah.
Because the concept of public health is preventative medicine. So a lot of times when we think of medicine, we think of doctors, hospitals, emergency, the different professions in that field. But oftentimes we don't think of preventative medicine, which is teaching people how to prevent themselves from ever even having to have emergency situations, like getting regular dental checkups, going to your regular physician, your PC, staying on top of medications that you're prescribed. We do things like create incentives to get people to participate in things. For example, vaccinations, all that stuff is public health. All the stuff you saw when COVID came out was public health. The epidemiologists.
Say that again?
Epidemiologist.
What's that? That's a big word. You got to break that down to regular folks, An
epidemiologist is somebody who studies the data that we get from the community about health, and then we'll pass that information on so that we can disperse it and make people more aware of what's going on and how to improve our health. And that's on lots of different levels. That's global, that's national, that's statewide, that's citywide levels.
Wow. So why choose that section? Why go into like public health? Why did you decide to go into public health?
So I'm in a unique position because I'm still studying medicine. So with my PA degree, I will eventually be a clinician, and I will provide medication and treatment and all of that in terms of like healthcare. But also I decided to do my public health degree because everything, like Hadia said, is public health. Like from the social determinants of health, which basically describes how everything in our reality, whether that's our lived environment, where we live, where we work, our occupations, all impact someone's health. And that leads to their present health state, which is what's seen at the hospital when you go to your doctor's office. So for me personally, I chose public health as a degree to pursue because I want to be a well-rounded clinician. I want to understand where my patients are coming from and not only treat the diseases that they have, but try to figure out treatment plans to make sure that A, they don't end up with the diseases or the health status that would bring them to the hospital, and B, to actually have a treatment plan that will actually work, that will be intentional about their lived experiences and what they've been going through that led them to that health state. So that's why I chose public health. And the key difference between medicine and public health is that public health is more community-based.
Yeah.
It's more like, not global, but it's not individualistic like medicine is. Medicine is more like a doctor treats a patient for a health condition, whereas public health is more the health of society, the health of a community, and everything that goes into effect that will trickle down to a person's individual health. If that makes
Yeah,
sense.
you actually answered my next question because I was actually going to ask you, you know, is there a difference between, you know, public health and clinical medicine, you know? I heard you guys talking about the different layers that you guys are in public health as the umbrella, but then also there's like different tiers, you know what I mean? So what tier did you say that you was in, or?
So I work specifically in Black maternal health. That's my passion. I love maternal health. That's
Maternal health have to do with babies being born?
So specifically Black maternal health because Black women are the highest rate of women who die during childbirth.
3 times.
And the
3 to 4
statistics are,
times.
3 to 4 times. On top of that, you have to consider the fact that it's preventable. It's not something that has to happen. There's nothing wrong with Black women besides the fact that they experience racism. Black women experience 3 to 5 more life stressors before the childbearing age than any other race. And majority of those stressors are due to things that are inflicted through racism. Socioeconomic status, stuff, healthcare access, the list goes on and on. It's a big problem that's picking up attention now, but does not get enough attention. And so currently I am the co-chair of 2 committees in the Mother Lab, which is the largest maternal health lab in the country.
Shout out.
Okay.
Yes. And
The Mother Lab. Wow, that's is this just like a whole bunch of mothers, or?
No. So it stands for, okay, hold on. Maternal Outcomes, Translational Health Equity. I forgot the R stands for. Oh.
So that just conveniently spelled mother?
Yes.
Wow,
Oh,
that's crazy.
wow.
I didn't know that.
That's
Dr. A finna get at me. Hey, Dr. A. Maternal Outcomes for Translational Health Equity Research Lab.
Wow.
And so what we do is we have 3 committees, and we each focus on different things. So we have marketing and comms, which focuses on pushing out public health information about Black maternal health. Then we have research and grants, which focuses on the research. Bring that back to the epidemiology. We have a committee that works on that. And then we have SEEP, which works on community engagement and making sure that we're not just finding information, but that we find it, push it, and then bring it actually to the people. So it's a dope lab. If you can, just look it up. But
Give it a follow on Instagram.
Yes, follow us, mother_lab. But definitely a great opportunity for people to be more aware of something that goes on. So that's my passion. That's my field.
Yeah.
My master's was in behavioral sciences and health communications, which helps me better interact with people when talking about such a difficult topic. So that's me.
And that's the same thing I'm doing.
Okay.
But I'm not doing maternal health, but behavioral science, which is a lot more psychology based.
Yes.
Yeah.
And that's kind of how, we started our financial literacy program, something like a lot more community based.
So do you think that let me ask you this, you think that's going to make you like a better doctor, being in that field?
I hope so.
Like, why? Like, because, okay, doctor-wise, you're dealing with medication, but then also you think that's going to help you, like, okay, have more empathy towards your clients or towards your patients, or just kind of have an idea, like, okay, yeah, you know what I mean? Like, because I feel like with public health, it's such a broad, you know what I mean? But I just feel like, does that make you like a better, doctor? Or
Yeah, I mean, like kind of how Annie said before, like getting like a broader perspective, right? And like you being actually in the field, I feel like especially with public health, we're a little bit more hands-on, and like you're more aware to your surroundings. Versus in medicine, everything is just so science-based, right?
I think there was a saying that one of our professors at Tufts gave us, and I will never forget it. Humans are irrational. You cannot depend on humans to do things just because it's good for them.
Right.
Otherwise, we'd all be in the gym every day. We'd all eat healthy every day. We'd never touch a burger. We'd never touch, French fries or soda or drink alcohol or any of those things. But we operate on what makes us feel good in a moment. And so when you think about that, and then you think about medicine in a space where medicine is very clinical, you don't have time as a doctor or physician oftentimes to invest in patients because everything's so individualized. You have a full work day of how many patients. You don't have time to be like, hey, how's your kid? How's your son? How's your grandma? What'd you eat this week? You don't have time to chit chat like that. Yeah. But public health provides a space to help increase behavior change by making people more aware of the benefits of the behavior change while still somehow incorporating things that already improve their lives. For example, with COVID, people were really against getting vaccinated in the Black community, right? Because it was like, whoa, we've had trauma with this before. Right. What does this look like?
Yeah, absolutely.
And
I agree.
So,
I was one of those people.
Yeah. And so a lot of public health people, we saw it at Tufts, right? It was very much like just get people vaccinated. And it was like, but hold on.
Right.
You got to address the fact of why people are not getting vaccinated in order to understand how you can influence them to do otherwise.
Right.
And so that is public health. It is the ability to step out of the hospital, out of the clinic, out of the medicine, and meet the people where they are to improve their mindset about healthcare, and then watch them little by little grow that in the spaces they live.
And I'm a firm believer that every healthcare provider, every clinician, doctors, PAs, nurses, whatever it may be, should have a public health background.
I agree.
Because you need to meet your patients where they're at. Yeah. And without a public health background, you don't understand what systemic barriers, what institutionalized barriers, racism, how that all affects a person's individual health. And like Angie said, medicine is so clinical. It's so scientific. And without having that humanity aspect of it in terms of public health, you are just treating the disease and not the patient. And it's important to treat the patient. And in order to understand that, you have to know and understand public health.
So which section are you working under? Because you mentioned you working under, what's that
Maternal
called?
health.
Maternal health. Which section are you
Yeah, so my MPH is more generic. It's more a basic public health degree. Yeah. But I am going to PA school. I will start PA school in January. And
PA school, what's that?
So physician assistants are basically advanced healthcare providers. Yeah. So in the hierarchy of medicine, you have like your techs, and then you have your nurses, and then you have your PAs, and then you have your doctors. So PAs work right underneath doctors. They have a lot of autonomy. They're still able to prescribe medications, have their own patients, identify different treatment plans, diagnose different diseases. And so a lot of the ways that PAs practice is similar to what doctors practice. But we work right underneath a doctor, and that's like the major difference.
Okay.
So yeah, that's my trajectory.
What about you, Ange? Which section are you working under? I mean, put me on, man. Y'all this is like a whole new different realm for me. I'm like, wow, I'm really like.
Well, I mean, I'm pretty sure I've told you this before.
You probably have,
but I'm doing behavioral science.
Behavioral science.
Yeah, and what I plan to do with it, to be honest, I'm not sure.
Yeah.
And that's okay?
Yeah, we're still in the process of figuring that out. But since we have started a lot of community engagement, I do want to do something in that field and continue to grow that.
Yeah.
But in terms of medicine and public health, I definitely do see the difference though. Because when I started medicine, we didn't learn like anything public health. There's a section like this big for public health. It's like 1 page of epidemiology, 1 page of biostats.
John Snow and
yeah, and that's literally it.
Yeah.
And then that's it. That's all we have to know. And you have to literally know these 2 sections. But everything that I've learned so much in my degree is just, it's so mind blowing because it's always been there.
Yeah.
And it's like, I didn't know it was there. You know?
Like, it's one of those things where because we studied it, we see it everywhere.
Exactly.
Like, we can't just like turn a blind eye.
Yeah.
But if you have no education on public health, you won't see it.
Yeah.
And something
And you will accept.
Exactly.
Yeah.
You will
So
accept
let me-
that it's going to
Yeah.
be inequitable,
Yeah.
and that's okay because that's what it's always
And that's
been.
why a lot of doctors
Yeah.
now are so problematic because they don't see what's actually happening, which is a detriment to them and their patient.
Yeah.
So, all right, quick question, all right? Because we live in Boston, and in Boston, there's this, on Mass Ave, there's this predominantly area where there's a lot of like crackheads that's just in that specific area, right? And recently in the news, they were saying that they was gonna move them. And most of the time you drive, you know, I think like a couple weeks ago, I drove down there and I ain't seen nobody. All the crackheads was basically gone. You know what I mean? Everything was gone. And then, like last week, I passed by there, they just pulled up again. You know what I mean? It's like, yo, we're back on the block. You know? And I was wondering, like, is that like something to do with public health? Or like, how does public health shape that?
So homelessness is a unique public health issue that is separate from the public health issue of drug use and abuse.
Okay.
And there are levels to that, and I doubt we have time to get into all of that. But there are a lot of barriers when it comes to that community that requires so much sensitivity. The concept of moving them is like, I saw it on the news myself. It was something that I instantly grabbed my computer and was like, whoa, what is moving mean?
So problematic.
Yeah, because their communities are very tight-knit because that's the family they built.
Exactly.
And a lot of their stories will...
Really? Like, so that's the... Cause I'm thinking crackhead community, or like, you know, I gotta be a little bit more sensitive towards that. But, you know...
We call them the homeless, not crackheads.
My apologies, folks. My apologies. Sorry, God, forgive me. Okay? But, you know, that is true. You know what I mean? Like, they because they do kind of like, you know, look after each other. I mean, I just pass by and I just see it, and I just...
And your assumption's not crazy.
Yeah.
Massachusetts is known for having a drug issue, an opioid issue. It's not something that's not known. So to assume that many of them got there somehow through drug use is not such a taboo thought. But I think the thing that we often don't consider when we see a homeless person or somebody who's asking for money or standing on a street corner who looks dirty, smells weird, whatever, is how did they get here? Because they were once somebody's son, daughter,
Student.
right?
Yeah,
They went to school.
Yeah.
Some of these people have had professions, were making money.
Yeah.
You know,
Yeah.
what got them there? Was it an injury that they got a prescription and it went crazy? Was it the wrong friend group? Was it an accident? Maybe they had a parent who was a drug user and they have a likeliness of becoming addicts themselves. What are they addicted to? How difficult is it to treat? Do they have access to treatment? Like, there's so many levels. So to look at them, and that's why Anissa said, when you're a public health professional, when you look at people, you see so much more than just, oh, they just want my money to go buy drugs.
Yeah.
It's like,
There's layers and layers and layers
Yeah.
to it. And answering your question about moving the camp, I think it's very problematic to what Hadia said. A lot of what they have is community-based. They rely on each other. And not only that, they rely on the resources surrounding them. And to move them from that area, that is problematic because they won't have access to the things that they need access to, especially because they have scarce resources. And so I'm from Salt Lake City, Utah, so I could speak more on...
You from Utah?
I'm from Utah.
There's black people in Utah?
There's 1%. That's me.
What?
I'm dead.
But
I didn't know there was black people
He
in
said
Utah.
there's black people in Utah. There's some of us.
there's some of us.
Wow.
You from Utah too?
No.
I didn't know there's black people in Utah. Yeah.
Black people everywhere.
We're literally everywhere.
Come on.
No, go ahead.
But in Salt Lake City, there's also a really big transient community, and there's a lot of issues there because if you know one thing about Utah is it's very white and very Mormon, and Salt Lake City, Utah is like the prime location for the Mormon church. It's
Yes.
like, do you know, I'm also Muslim. It's like the Hajj of Islam is like the place for Mormons.
Yes.
That's where the religion was born. Their temple is there. So Salt Lake City is unique in that sense, and because of that, they pride themselves on having clean streets. And because everything is, it's like a utopia. If you go there, it's very clean for a reason. Because people from all over the world who are Mormon come to the temples there. And because of that, they push out a lot of the transient communities, so it's not visible within the city. And there's a location in a specific part of downtown called 4th Street block, and there's a 4th Street clinic. And that was also where the homeless shelter was. And that place was a prime location for the transient community because they had access to free transportation. So transportation within a certain radius is free within the city. And that is where the 4th Minute Clinic was, and that's where the homeless shelter was also. So they had so much resources within that pocket.
You mentioned 4th Minute. What's that?
4th Street Clinic. That's that's the clinic that houses and treats people who either are undocumented, who don't have health insurance. It's like a free clinic that they could like receive services from. But because they decided to like move that homeless shelter there, now all of the homeless people there have like 10 times the barriers because they don't have access to the free transportation. They don't have access to the clinic that is so dire to them. And so there's so many things at play that you need to think about, not just cleaning the streets just to clean them.
Got it. Yo, and you mentioned that you was working with under the segment that you're under is behavioral science, right? Because I remember when we was putting together our play for the for our financial literacy, you brought some interesting stats whereas like you mentioned that students or young adults that's in Dorchester, Mattapan, Roxbury, these are the times that basically they're not gonna go towards a higher education. These kids is not going to go to college, not going to go to grad school, none of these things. So it's best that we're able to service these students or these kids at these particular times. You know what I'm saying? So my question is there like a stat that you guys go over that kind of like, okay, this person in this neighborhood, more than likely they're going to be a success. This young fellow over here in Dorchester, depending on where he's raised at, he's probably going to be a bum, or he's going to be somewhere in jail, or any of that sense. Do you guys like? Do you study that in public health or in behavioral science?
Yeah, I would say that's Healthy People 2020. Is it 2024 now?
Yeah, the new one.
2024. Yeah.
What's that? Healthy People.
Healthy People. Healthy People. It's pretty broad.
Yeah.
But I know that it's like pretty much all the statistics and the goals of like what they pretty much want to achieve in public health.
Yeah.
Healthy. I haven't actually seen 2024. I think the last one I was on was the 2020.
Yeah.
But that is where we got the stats from actually, which told us like the level of education in certain neighborhoods. And most people, their highest level of education is high school in these neighborhoods.
Yeah.
But those stats do not omit bias.
Yeah.
What do you mean by that?
So the statistics that we see about certain communities are based off of patterns that are witnessed in those communities, but those stats don't account for the reasons those stats exist.
Exactly.
So
The reason why there's a lot of like lack of education in these communities can stem back to like redlining. There's a reason why resources were deprived in these settings, which prevents people from getting the proper education that they need, or just the resources. That's why there's food deserts and food swamps, which is basically areas where there's no grocery stores with healthy foods and fresh produce. That in turn increases obesity in these communities.
Right.
So it's like this cycle that's just continuous, and everything just is at play to just cause barriers and hurt the communities that are most vulnerable.
Wow, I'm learning so much. Okay, right now we into this is a section of our show called the Talk to 'em Trivia, and y'all can't look at my paper, okay?
Cheesy.
All right, so listen. All right, let's see if you guys know y'all trivia, okay? What was Aretha Franklin's first #1 hit?
Oh, I'm not gonna get this right.
Oh, it starts with an R.
Respect.
Or respect.
Yeah.
I was gonna
Okay, yeah.
First one.
Okay, see, y'all.
I didn't know what the first one was. She was singing for a very long time.
See, this ain't public health. Okay. All right. So I give y'all that. I can't give y'all points for that. I give y'all the big clue. All right. Here we go. Here we go. All right. Y'all watch the show Martin?
I have, yes.
You watched the show? You haven't watched it? See, that's what happens when you're in Utah. Okay? All right? Okay. There's no BET out there. All right. So, since you watch Martin, you watch Martin.
Yeah, but like.
See,
All right.
to get my black card revoked.
So here we go. In which U.S. city is the series Martin based in?
I don't want to say Chicago.
I want to say Chicago as well.
Close, but no, that's not Chicago.
Okay, wait. Can we?
You said close?
It's close.
It's not New York.
Starts with the letter D.
Detroit?
Detroit. All right. Okay. All right. So, let's get back to this conversation, right?
Boo.
How?
Those were bad questions.
No. Okay. Let me ask y'all this, because you guys speak with a lot of passion in public health, and each of you guys have just different backgrounds. How do you think your contribution is going to? How do you think you're going to contribute to public health? Is basically my question. How do you think your own personal background, things that you dealt with, how you think you're going to bring that knowledge into your career as in public health?
I think me and Angie could relate on this, but for me personally, is bridging the gap between medicine and public health. It's very fragmented, and there's a big stretch between public health and medicine, and instead it should be one overarching thing. And so that is what I'm trying to aim for, and not only that, like a lot of my reasonings to get an MPH is also to contribute to research. So I want to do research. I want to diversify the literature that's out there. I want to do research in areas that are not heavily researched because of multiple things, whether that be racism or just like the lack of trust within communities of color, which is rightfully so. And I think that diversifying public health and medicine is important to bridge that gap, to build trust with communities, because that's our community. It's my community.
That's true.
And so that's very important to me.
What about you, Ange?
I agree. Definitely that gap. And I think like the empathy, which I feel like is part of that gap of public health and medicine. Like it's like two different worlds, but yet we're all part of the same world. So it's like just connecting these together. And obviously like not, two people are not going to be able to
Right.
accomplish
Exactly.
that goal.
Mhm.
But I do know that public health has become like way more of a topic of discussion ever since the pandemic.
Right.
So I think the more awareness that we bring to public health, and I don't think people really realize that public health is so broad.
Seriously.
Like it's not just like medicine and health.
Yeah.
It's everything.
Yeah, it's like literally everything. Like we always talk about this, like just even when you're just driving down the street, like that the tree, this is related to public health
For
and the
real.
roads
Urban
and yeah,
infrastructure.
everything.
Uh-huh.
You know, so
Hostile architecture.
yeah,
Exactly.
everything is related to public health. So I feel like
Sidewalks.
that's the good thing about public health is that there is careers and employment like a lot,
Mm-hmm.
and I think people don't really realize that.
Yeah.
Yeah.
I think, like, also, okay, because we went to your graduation, right?
Yeah,
Okay. I want to make sure that you're the right person. Okay. So, listen, right, and I thought it was real cool because when you was graduating, there was little kids that was there as well, too, and they're seeing you graduate, you know what I mean? So that's actually sparking, that thought, like, yo, if Big Sis could do it, you know what I'm saying? Like, I could do it as well. That's why I asked you that question because, there's a lot of lost girls out here, you know what I'm saying? And that don't really have a direction who looks like you guys, you know what I mean? And y'all are fly, y'all got, got a lot of things going on. I think y'all are creating a wave of, of women who are, in these spaces and that's doing the thing. You know what I mean? So that's why I asked you guys, what contribution do you see yourself, but you didn't answer that
Yeah,
question.
I think I'm a little bit different than them for the simple reason that I actually wanted to be an OB. I've always loved maternal health. It's always been my passion.
OB,
An obstetrician, a gynecologist.
okay,
Yeah.
okay. I'm thinking like OB.
no.
OB choice?
OB.
No, you wasn't.
I'm like OB.
I knew you
like,
were saying OB.
what is that? Okay, yep, go ahead.
And so that was always my passion. My aunt was pregnant when I was really little, and she used to watch this show called The Baby Story on TLC. And like, I used to see the doctor being like, all right, come on, you got this, push it out. I was like, oh, I want to do that. That was my passion. Went to undergrad, got my bachelor's in biology, every intention of going to medical school. And I went to the director of my department and I was like, Dr. V, I don't think I love medicine. And she was like, what do you mean? And I was like, I think the part that I love about it is that joy of that mom when she holds her baby. That moment of like, I did this. And she was like, okay. And if any of y'all are young and watching this question changed my life. If you could describe your perfect job and you had no barriers to what that would be, not considering any other titles that exist, what would it be? And I just was like, I would love to be somebody who educates people about maternal health, and I get to be in the room with them and like make them feel good about that. But I'd love to do it on like a broad spectrum. And like, I rambled, and she was like, have you ever heard of public health? And I was like, huh. Looked it up. That was it.
Yeah.
And so for me, my change is on an educational level. And people go, do you want to go into academia? I don't know yet. But I for sure want to create spaces for two groups of people. I want to create spaces for minority birthing people. I want them to come get educated about their experiences, have resources to doulas, to incorporate all the things that people with money can pay for into a system that is affordable, accessible, and something attainable for them that they feel like is tangible for them to complete, to get through. I also want to create collaboratives in medical settings where people like doctors and nurses can come talk to people like doulas who are birth supports and can assist in birthing situations and spaces where anxiety is high, birth is stressful, And so my last goal with my public health degree is to open a clinic in St. Lucia, which is where my mom is from. And my grandmother died from a UTI. Well, it's more complicated than that, but that was one of the things that really like kind of amplified the situation. And I always asked myself if she had just known to take some cranberry pills, you know, like maybe she might have lived a little bit longer, you know. And so access to medicine in the Caribbean has always been something that's like, you know, doctor, you dying? Like, no.
Yeah.
Like, you know, it's like, no, drink some tea. You know, do this, do that, rub some Vicks. It's like...
Vicks is everything.
Ours is Tiger Balm.
Tiger Balm.
Ghanaians use that. Okay?
No.
And there's no shade.
Asians use Louis Muscati. It's like this oil, like, it's weird. It's called Louis
And there's
Muscati.
no shade to those things because they have their purposes.
Yeah.
Like, these old wives' tales didn't come out of nowhere. Like, some of this stuff really does work. But, as you said, marrying the two. And the reality is the marrying of the two is not as difficult as the world likes to make it seem. It's just that preventative medicine means that there's a less need for medicine, which means less money in the pockets. And that's a whole other thing. But so for me, it's really creating spaces for people who look like me and people who are going to be serving the people who look like me. And, you know, I'm not trying to die on nobody's table, and I want to be a mom one day.
Yeah.
And so just creating spaces where everything is not based on, oh, this, oh, this, oh, this. I mean, obstetrics in itself is based in racism. And to this day, we have racist practices. And obstetrics wouldn't exist without Black women.
Really?
Yes.
Wow. So let me ask y'all this, right? Do y'all think, okay, let me ask y'all this. So, all right. I read this statistic that it said more women of color birth, they don't give natural birth. It's more of like a C-section, you know. And my question is that something that's done on purpose, where it's like, okay, she can actually, you know, deliver her baby naturally, but because it costs more money, right, we're gonna give her, she's gonna, you know, what's that called again? Do a C-section. So is that something that has to do with public health, or that's mainly more towards like the hospital and them wanting to make more money? You know, that's my question. Yeah.
It is a public health issue introduced by medicine. So if you had a C-section ever, the belief in medicine now is that you can never deliver vaginally. You should always have a cesarean, which is not true. And the other side of that is a lot of Black women don't know that you have the autonomy to be like, I don't want that.
Exactly.
Really?
Yeah.
Imagine you're giving birth, right?
Yeah.
I mean,
Not me.
just picture it, right?
I'm not giving birth.
And just imagine, but you know, you've seen like the on TV, like the anxiety. She's screaming, she's in pain. There's so much going, and the doctor's like, "All right, the baby's not coming fast enough. We're gonna just." You think you're gonna go?
Yeah.
The doctor just told you, we're gonna do this, this, this. He didn't, or she didn't say, "Hi, this is where we are right now. I'm thinking about this. How do you feel about it?"
Yeah.
Which is why I mentioned doulas. A doula can help you be aware of things to listen for and know when to advocate for yourself.
And they're in the room while you're giving birth, and they call a doula. Oh snap! I didn't know that.
Yes.
So is everybody can have a doula, or is that based off just like your insurance level or how much money you have?
So the world is working on it.
Yeah.
I'm a doula, and a doula right now in some states I believe is available by insurance, but for the most part they have just gotten respect status in the community of medicine because we're technically not we are not medical professionals.
Right.
Our goal is not to administer medicine, to give medical advice, any of those things. We are literally there to support. So we do comfort measures. We bring awareness to things that are going on to prepare you. We help you prepare a birth plan that's realistic. We help you stick to your birth plan when if it's healthy for you to continue.
Wow.
So just stuff like that. And it's such a small change, but such a big influence. But one of the things that sucks about doulas right now is because most doulas are independently funded through their businesses and not through insurance agency,
Mhm.
etc. To get a doula, you gotta pay money.
Yep.
And if you don't have money, which oftentimes is a lot of people in our community, how are you going to afford a doula?
Mhm.
So then you're stuck giving birth at the most basic rate that is available for you.
Wow. I didn't know that because there's a lot of pressure, you know what I mean? Especially when the doctors come in there and they just, because you're already under a lot of pressure, you're giving birth, you're worried, you're scared, and all of a sudden, yo, we got to give it to you, you know, we got to take the baby out C-section, and then you're like, whoa, you know what I mean? Like that's a lot of pressure, and you don't even really think about, I know I don't think about stuff like that, but I never knew about a doula.
Yeah.
You know, I just learned something new today about a doula. I always thought, you know, you're here for support. You know what I
Everybody
mean?
who's giving birth should have a doula.
On deck.
Everybody. Or
Okay.
at least access to one. You should have the option to have a doula at no cost to you. Just like you have the option to get medical help at no cost to you.
Wow. Wow. I never knew that. I never knew that. Let me ask y'all this. Who's responsible for public health? Like who's responsible? What part of is that like a government thing or
Everybody.
is that how does that work? Who's
That's my
responsible?
answer too. Yeah.
Who are the stakeholders?
Exactly.
Everyone.
Who's the stakeholders? Yeah, or who runs it? Who's responsible?
I feel like there is the governing body, the CDC.
Yeah.
Yeah.
They do a lot of the research. They implement all of the policies and regulations that impact public health.
Mm-hmm.
But in reality, everyone is responsible for public health. I am, you are, we all are. Because we are living in this world, and so we have the responsibility to make sure that everyone is healthy and happy. And so I feel like it's all of us at the end of the day.
Wow. Yeah, I didn't know that. I always thought somebody, I mean, at least like the government, you know what I mean? Because they're the one, okay, we talked about, you know, the vaccine, you know what I mean? Like people not wanting to take it, but that was being forced to us through government, you know what I mean? So I would think like government is more
Yeah.
the majority of the stakeholders.
There's levels
There's
to
levels
it.
to it.
Yeah.
I think the
Yeah.
government also steps in at certain times, and because COVID was literally taking over the world,
Yeah.
and there was so much panic, and because they already looked bad because it was something they could have helped reduce the effect of but didn't step in sooner,
Mm-hmm.
it was like damage control.
Yeah, yeah, yeah.
And so it seemed like they were responsible for it,
Mm-hmm.
but in reality, it's all of us.
It's all of us, yeah.
All of us. We're going to get to some of our sponsors, folks. Big shout out to the good folks over at Shop Talk to Them. Make sure you check out their Instagram handle at Shop, SHOPTALK, the number 2EM. Green to Clean Ltd. Okay, good folks over at Community Capital Gains. Their Instagram handle is at CCG Gains. And of course, Each with Ree. And this episode is brought to you by Levesque Entertainment Group. Here's another question that I had, right? Like, okay, we're gonna get into this. Y'all heard about the whole Kanye situation, right? And I just wanted to, okay, right? Like, I read this article, right?
I'm biased. I'm putting it out there.
And I just wanted to know if this falls underneath public health, right? And according to, CNN, it says on the surface, the case of Kanye West seems pretty cut and dry. West made anti-Semitic remarks that caused companies that he was affiliated with, including Adidas and Balenciaga, to end their relationship with him, bringing to an end his tenure on Forbes' billionaire list. But the million-dollar question is, why didn't this happen a long time ago, given West's history of making anti-black statements, right? Now, does what he says, right, does that fall under, like, public health? Because according to public health, right, and I did a little bit of research of
Okay,
this.
now, come on.
And the core values of public health are protection, prevention, and promotion, right? And he made this statement, and I don't think, I don't know what, I had to look up the word anti-Semitic. I didn't know what that meant. And it doesn't sound like he was being mean. It doesn't look like he was being mean, or he was using that into like hurting anybody or hating anybody. It's more, he was just making his people aware. You know what I mean? Like, this is what's happening. This is what he's going through in his world, you know? So, like, is that something that basically falls under public health, if my question makes any sense? You know? Does it make sense? You know, because
It does.
protection, prevention, promotion, right? Which is the core values of public health. You know, so, and I think, you know, basically he's promoting that. You know what I mean? He's promoting, okay, about certain people being you know, you talked about racism, you know what I mean? We talked about you know, the whole vaccination, you know what I mean? How people in our community was kind of like, you know, standoffish towards the vaccination card, you know, getting the vaccine. So yeah, my question is like, yo, does that fall underneath public health? You know what I mean? Regardless of what how we personally feel about it, but is that like a public health issue?
I think so.
Why?
I feel like I'm always the first one to
Yeah.
answer. I don't know why, but I think so, because the effects promote racism, and I think there's nothing more dangerous in the black community than black people hurting other black people. Because not to pivot, but I read yesterday something about when Megan Thee Stallion, Drake dropped an album.
I saw that, yeah.
And disclaimer, I am not the person to ask about rappers. I like a good 90s vibe. Give me some R&B. I got you.
Yeah.
So I don't really stay too up to date on everything.
Right.
But I saw the story and I clicked on it. I didn't know what Drake had said. I hadn't listened to the album. And I guess he had dropped some type of lyric saying something along the lines of, she keeps talking about this shooting that I guess is not real.
Yeah.
And I was offended for two reasons. One, in my mind, you would think it would be common sense to be aware of the fact that it's not to joke about someone being shot.
Right.
It's not to joke about someone using guns for violence just to say you have a gun or do whatever. We already have seen countless times, from adolescent children to grown adults. We just saw Takeoff die.
Crazy. Rest in peace, Takeoff.
Yeah. And you're going to still release that? And then the other side of it is, let's say that is the homie. Like, and you believe him over her. Why monetize that? You're giving the racist people, the anti-Semitic people, the ammunition to say, well, Drake said it about y'all, so why can't I say it about y'all?
Right.
And so to bring that home back to the Kanye thing, that's kind of how I feel about a lot of things Kanye says. You're giving them ammo to say, well, Kanye is black, and Kanye said, so why can't we say? He wore a shirt that said, what did he say? What did the shirt say? White Lives Matter.
Right.
That was never in question.
Right.
But you allowed that
Yeah.
to become a thing now, to take away from the focus, which is that we don't have equity and justice in America.
Yeah.
So, like I said, I'm biased.
But do you think do you think that's like, do you think like other races see how it is that we treat each other? Right?
Absolutely.
And they're like, yo, these guys are killing each other, yo. So they might not really care about each other like that, you know. Or look at what they putting in their music, how they objectifying their women, you know what I mean, as, you know, whatever. So it's like, do you think that gives them like the leeway to be like, oh, okay, it's cool. You know what I mean? Because I honestly, I rock with Kanye. You know what I mean? Heavy. You know, and I think the reason
Kanye, old Kanye, Kanye.
Well, the thing is, right? The thing is, the reason why because I listen to Kanye since through The Wire. You know what I mean? I just think like, yo, he's gone through so much. You know what I mean? He's gone through so much in the public eye, right? And yes, this man probably has issues, in which we all have issues, and we all say some dumb shit at times. You know what I'm saying? But I just don't think. I don't think like what they're making it out to be. I don't think that's what it is. You know what I mean? I think they're using him as like a scapegoat. You know, and I think there's a bigger message. You know what I mean? I use this analogy like Kanye's not like a freestyle rapper. He's like a rapper that he needs his bars written for him. You know what I mean? Just like he needs, whenever he's about to speak, yo, you got to write this for him. You know, like he's got to basically, he can't come off the top, because when he come off the top, like he doesn't sound very, you know, intelligent. You know what I mean? But I'm somebody who listens. I listen to what is this person saying. What's he saying? What does he mean by that? What did you mean by when you wore the White Lives Matter shirt, knowing that, yo, people from Chicago, people from, you know, inner cities is being killed all day, every day by these cops. What did you mean by that? And I think as people of color, you know, we're just so like, it's easy to dismiss somebody. You know what I mean? Whereas like, yo, where you coming from with that? You know what I mean? Because where is the empathy? You know what I'm saying? Where is the empathy? Or what did you mean? Because, yo, if you say something to the media, you know what I'm saying? You might be going at it in a certain manner, right? But, you know, I might not tell you like, this is, you know what I mean? This is what I mean by it. You know what I mean? Whereas like you see somebody's heart, you see their intentions. And then if you see somebody's heart and you know their intentions is pure, then you're like, okay, I understand where he's going with this right here.
So where do you think he was going?
I think what he was really doing, right? Because I think even with the interview that happened on Drink Champs, I just think, yo, number one, like, y'all shouldn't have been drinking, y'all shouldn't have been smoking, there shouldn't have been no type of nothing on that. You know what I mean? And plus, I don't think Noriega was the perfect person to, you know, conduct that interview. You know what I mean? Because if you're gonna make a statement like that, you need backlash. You need to go at him, like, you know, just being able to, you know, what did you mean by that? You know what I'm saying? What did you mean by what it is that you were saying? Because I don't see it in him. If you look at somebody's music, he doesn't make music that kills people. You know what I'm saying? Like Kanye don't make music that kill people. Maybe he might team up with somebody, you know what I mean, like a Chief Keef like that or something like that, because, you know, but he doesn't make music. Listen to Kanye's music. He doesn't make music that kills. You know what I mean? He makes music that's like, you know, brings you life. You know what I mean?
Yeah, I think the most like problematic thing about like what he said in just this conversation in general is the stance that he holds and the platform that he has. And because of that, I feel like it's very problematic to say things that are out of line, because to what Hadia said, it will allow people to listen to what he says and run with it. With all of the anti-Semitic remarks, that will just fuel what they think and they will run with it. With all of the anti-blackness, the white people will hear what he has to say and they will run with it. And so I feel like that's where the danger lies.
Yeah.
Is the power that he holds, and when he says something, it fuels other things. And I feel like that's the biggest issue there.
And I want to add to that. I hope I don't say it.
Speak from the heart, fam.
Kanye for me goes with the highest bidder. I don't have respect for a person who will compromise their integrity for a check.
Mhm.
I asked you, do you like old Kanye, new Kanye, both Kanye? Because I grew up listening to some of Kanye.
Right.
And you know, some of those lyrics that he said, he ate and then did. He talked about marrying, being with outside of your race, no shade to that, but then he did it. And that's not to say that's a bad thing, but it's like there's this constant contradiction of self.
Yeah.
And
But I think that's us as human beings, fam. How many times
evolving, absolutely.
How many times you said something, you know, you're not the
But
same person that you was when you
where
was
is
14.
Kanye evolving to?
I don't know. I think, I don't know, because I'm not Kanye. I'm just a fan, and I look at him as like somebody who's operating at a very high level. You know what I'm saying? At a very high level, dealing with these companies on a one-to-one basis, and he's probably experiencing racism. He's probably experiencing certain things that he can't communicate to us. I don't know how that's like. I don't know how it's like communicating with Balenciaga or feeling some type of way, and I'm dealing with Adidas. But I know that as a black man, right? As a black man, like, yo, it can't be easy. You know what I mean? It's like, yo, you're like the little, I'm a billionaire, but you're like, oh, you're still a little boy. You know what I'm saying? You're still a little boy. So when you feeling like, yo, I'm a little boy, these dudes ain't gonna come at me like this. You know what? I got something for y'all. And that's why I think he went on what he went, and he said certain things that he said, and he did certain things that he did. And plus, I'm not somebody that, yo, I like, especially if you cut from the same shade as me, there's certain rules that I don't talk about you in public. You know what I'm saying? I'm gonna get you behind closed doors. You know what I mean? But I'm not going to talk bad about you in public, because it shows that, like, yo, I got respect for you. You know what I mean? And if I move, that's how I move personally. You know what I mean? I'm not gonna say that in public, but behind closed doors, I'm gonna let you know, bro, like, you was wrong about that. You know what I'm saying? You was wrong about it. And that's how, everybody's different. You know what I mean? Everybody look at him as like somebody who's, I don't see it. I don't see him like, preaching like hate or any of these things. Like, I listen to Kanye's music. He never talks about killing anybody.
But killing is not the only danger.
Yeah, it's so much more than that. And I feel like to have that degree to have that social capital, like, you have to be careful with what you say.
Yeah, you do. Yeah.
And you have to realize that you're going to be held accountable for what you say.
Yeah.
And it's true, like, he should have been held accountable when he was saying all of the anti-black rhetoric. But he wasn't. And now, because he said all of these anti-Semitic remarks, what he said was not right. And he is being held accountable now, and that's for reasons that is different. But in reality, like, if you hold a stance like that, you have to be careful with what you say, because
you got to stand 10 toes on that.
Exactly.
Right.
And not just that, but you also have to really understand that if I say something to you crazy out in public, then I owe you a public apology.
Mm-hmm.
Right.
So you will hold me accountable publicly.
Mm-hmm.
Right.
Kanye makes these comments publicly.
Mm-hmm.
And he makes them to some of the people who constantly degrade, break down, destroy, separate, stand between black people.
Mm-hmm. Mm-hmm.
I mean, not to get into it, but Candace Owens?
Okay.
Like,
You don't rock with Candace Owens?
I can't say that I do. I can't say that I hate her. I can't say that some of the stuff she says isn't valuable. And I think that's part of it. It's not to say that holding black people accountable for the part we have to play in our own demise is wrong.
Mm-hmm.
But it is terrible to not hold other people accountable and consider the things that impact the way that black people exist in today. we can point the finger and be like, pull yourself up by your bootstraps. Some people don't have bootstraps.
Yeah.
And that's the public health side.
Right.
You can't say to a black person, well, you do it to yourself. You didn't go to school. If I don't have a template on how to get there,
Yeah.
if I don't know how to get to school, I'm a teacher. I teach middle school engineering and technology
Right.
and humanities. I have kids who I see maybe 3 times a week.
Right.
They're not coming to school. They don't have parents who make them come to school. If they come to school, they're not paying attention. They sit there, they talk, they kiki and do whatever. And then you're at school and you're like, come on, do your work. Hey, you didn't turn this in. What's going on? You send an email, you don't get a response. You call, no, just a ring. Like, it starts there. And then it gets there. And then you're like, well, you should have gone to college and got that degree.
I hear you on that.
So I'm not saying don't hold black people accountable. I'm saying it is so dangerous to hold black people accountable for things they cannot control. But then it's also dangerous to be in a space where we're like, hey, let's talk about this publicly and also support the people who we know don't care if we get there or not. Because Candace might care.
Right.
Kanye might care.
Right.
It might come across real harsh.
Right.
It might come across real dangerous.
Right.
They might care. I'm not saying they don't care about black people. What I'm saying is their delivery sucks.
Yeah.
And on top of their delivery sucking, we get to this point where we are very much not addressing the underlying things that put us in those positions. If they took that same power they have and said, you know what? I'm not seeing this, and this. So I'm going to do this, and this to ensure we get there. I think it'd be a very different conversation because then be like, well, he said this, but you know what? He's in the community, and this is the work that he's doing to combat that.
So, Pete, right? That's great that you mentioned that because, so while we're doing our financial literacy courses, right? We found out like there's a lot of programs for students in Boston. There's so many programs, right? But a lot of the times, number one, like these kids don't take advantage of these programs, and I don't know if that they don't know about them.
I was just about to ask,
But sometimes they do know, and then yet again, it's like there's no sense of, I don't know, urgency. You know what I mean? I don't know if there's like, if there's a sense of urgency, or even if they're like, they care to even know about these things. You know what I mean? Because there's this program, right? I think it's called, basically, they pay students, right? They pay students to come and actually go through their program. They pay you. And then that's basically how we come in as financial literacy. Once you get paid, what are you going to do with that money that you get paid, right? So there's so many programs that pay these students to get money to actually come to school, to actually, okay, you don't want to come to school, here's this other program that can actually, let's say you want to get into, I don't know, plumbing or whatever that is, you know what I mean? You could actually do this program and we'll pay you. And still, right, students don't show up. You know what I mean? Students don't show up, or they don't even find it like important to even show up. So I definitely agree with what you're saying, but also when do we as a community be like, yo, Tyrone, what are you doing? You know what I'm saying? You got to get it together.
Is it Tyrone's responsibility or Tyrone's parents' responsibility? I
think it's both. I think it's both. But then also the culture that we're in, fam. You know what I mean? Look at the culture. Look at rap music, the culture. This goes into public health. Like, sometimes rap music, it makes me sick. I'm like, damn, this shit is horrible.
That's why I don't
You know what I mean?
listen to
This
it.
shit is like bad for your soul, You just feel some type of way, and you like, it's not even the type of music that you're like, you feel kind of like dirty a little bit. You know what I mean? And do we hold ourselves accountable? Do we hold the rappers accountable? Do we hold the parents accountable? Who do we hold accountable? Because I feel like we're always looking for somebody to blame.
All the above.
You know what I mean? We always looking for somebody to blame, and that's why this.
Everyone is responsible for public health.
Damn, that is true. So it goes back towards everybody's responsible.
And health is not just physical; it's mental, it's spiritual, it's
emotional,
everything.
Y'all just drop some bars on me real quick, you know. Angie, you was gonna say something?
No.
Like, huh?
I say to my kids every day, I was like, y'all so fake hard. Y'all swear you hard. You want to be hard so bad.
Right.
There was
For real.
there was like this dance, and one of my kids came like, Miss Severin, can you do the naughty bop? I was like, what's the naughty bop?
Yeah.
What is that?
What's the naughty
So I
bop?
looked it up, and it's this this really sad story of like a 12-year-old who was murdered, and I guess the guy associated with the people who murdered him or something like that
Yeah.
made a song about it.
Mm,
And I said, you guys, that could be you.
yeah.
I took a whole class to like be like, guys, if I hear anything, detention.
Yeah.
And I don't give detentions because I think it's a waste of their time and my
Yeah.
time. They
Yeah,
don't
yeah.
care. They just sit there, and I gotta stay there too.
Yeah.
I'm good. But I made them know it was something that I cared about. I told them your minds hold so much power. I said in my classroom, I truly believe you guys are gonna change the world, but you have to tell yourself you have that ability to do so. And so, not every teacher does that. I mean, I worked in the Alabama school system, and I went to college in Alabama.
Mm-hmm.
And I literally saw a teacher look at a little 3rd, 4th grader and say, if you can't get it right now, you're going to end up in jail before you even hit high school.
Mm.
And I remember saying to myself, what in the world could a 3rd grader do at, what is that, like 8 or 9?
Yeah.
What could they possibly do that you could look them in the face, knowing the statistics stacked against them, and they live in the and operate in the Alabama education system, and you're gonna look at them and say, you're going nowhere.
Mm.
It blows. So everybody's accountable, but everybody's accountable for certain departments, and the reality is if everybody would work together, it'd come together like a puzzle.
Yeah.
But we don't all work together.
And also, we also don't communicate.
Mm-hmm.
You know what I mean? I think that's what we need to do. We need to have just communication. You know what I mean? Even the people who are feeling, anti-Semitic, have a conversation. You know what I mean? It doesn't hurt to have a conversation, publicly. You know what I mean? Because there's certain things that was done to black people, right? That what's that called? When, trauma. It builds trauma. You know what I mean? Like, I feel like as black folks, we have a lot of trauma that we have to deal with. You know what I mean? And that comes out in our music, that comes out in our dance, that comes out, how we treat, each other, how we treat our families, everything. So definitely having a conversation, just open dialogue. More than welcome to pull up to talk to them and have those conversations, So, any final thoughts, folks? Any final thoughts? I've gotten so much out of this conversation, like about, public health, education, medicine. Any, final thoughts that you want to leave us with? Huh?
Everything's public health.
Oh.
I think that's
so
That's what
true.
we should leave off on.
Everything is public health.
And everyone's responsible for
Everyone's
it.
responsible.
And everyone's going to leave a footprint. So what footprint are you going to leave?
Boom, we're going to end it at that. And I'm going to leave you guys with this quote. It is better to fail in originality than to succeed in imitation. It's your main man, Jay. Live, love, light. Thanks for listening. Peace and blessings.